health officials are growing worried about a so-called triple-demic, an onslaught of respiratory illnesses that has many medical experts concerned for the upcoming winter season. The culprits? A surge in cases of respiratory syncytial virus or RSV, combined with an increase in COVID in an earlier than normal flu season. Those mostly impacted by RSV are infants under the age of 5 and adults over the age of 65. And emergency rooms are already feeling the impact of an earlier than normal surge, according to Dr. Peter Hotez.
Pediatric emergency rooms are getting flooded with patients, kids with RSV. You usually don't see it in the fall. It usually as we get closer to the winter, but it's happening earlier this year, possibly because kids have not been in contact with one another for a couple of years because of social distancing or masks. And again, among older individuals, it can cause pneumonia, and it's very hard to distinguish that from influenza or COVID-19.
Meanwhile, data from the U.S. Centers for Disease Control and Prevention shows that the coronavirus is still spreading and claiming lives, with the United States reporting 260,000 new cases a week and over 2,500 deaths, which is why U.S. President Joe Biden on Tuesday urged more Americans to get the booster before the upcoming holiday season.
We still have hundreds of people dying each day from COVID in this country, hundreds. That number is likely to rise this winter. But this year is different from the past. This year, nearly every death is preventable. Let me say it again. Nearly every death is preventable.
Only 20 million people in the United States have received an updated COVID booster, and just 1 in 5 seniors, the White House said last week. Another looming threat is the flu. The CDC said earlier this month that there are early increases in seasonal flu activity reported in most of the United States. And Dr. Hotez warns patients can get more than one infection at once.
With 3 different viruses circulating, one of the reasons why you might be seeing more hospitalizations is kids or adults are getting co-infections, some combination of RSV with COVID, with influenza, and by the way, other respiratory viruses. So if you can take 1 or 2 of them off the table by getting vaccinated, that's a big help.